everyone, my name is Kaitlyn Waite, and I chose anger management as the intervention that I'm going to talk to you guys about. So, anger is not a skill that we are born with, it's something that we must learn. So, it becomes a problem when, I guess I should say, anger becomes a problem when we don't know how to express that emotion appropriately, or we're doing it for prolonged periods of time. So, anger management is learned, which is why we do need to provide some interventions for people who have a problem expressing anger. So, some definitions that are important to know. Anger is a natural response to a situation in which a person feels threatened, treated unfairly, or is confronting a harmful situation. Aggression is the actions that we direct toward people or objects with the intention to harm or destroy. And then violence is a manifestation of aggression. So to sum it up, anger is the emotion, aggression is the behavior, and then violence is essentially a sign of aggression. And these were all listed in our textbook. So there are different components of anger. There is thought of anger. So it's when we feel taken advantage of or something's unfair. The book says feeling trespassed, and basically that means we feel taken advantage of in a situation. It could be conscious or unconscious. So obviously conscious is we're aware of the thought. An example of an unconscious thought would be reacting a certain way, but not understanding what thought provoked that action. There's a bodily reaction, which is physiological, something that we do that we don't necessarily, it's a body reaction. So we're not doing it on purpose. It might be something that just, it's our body reacting to our feeling. So if you've ever heard the phrase like that got my blood boiling, that's an example of someone's bodily reaction. So clenching fists, heart racing are very common with anger. And then attack is when we act on the anger. We either lash out verbally or physically. So going back to anger, like I said before, we have to learn how to feel anger and cope appropriately and react appropriately. So cognitive behavioral intervention is really what is most, it is the intervention discussed in the book for anger management. The history is basically, it started in the 1960s when therapists were not satisfied with just using a behavioral approach to anger. Social learning theorists kind of brought in some research saying that our perception of something is going to change our behavior. So that's kind of how the cognitive behavioral intervention started. The cognitive aspect tacked on to what we already knew about behavior and learning behaviors. So cognitive behavioral therapy or cognitive behavioral intervention combines the cognitive model and the behavioral model. Cognitive is the theory that distorted thoughts lead to negative feelings and behaviors. And behavioral theory says that external environment and events affect our feelings and behaviors. So this approach combines those two theories. And basically how it's utilized is we as therapists want to help a person become aware of their distorted thoughts so that they are aware of them and can change their behavior on how they act on those feelings and thoughts. So the cognitive model, we want to change the person's distorted thoughts, whereas the behavioral model is where we're reinforcing behaviors we want. So like behaviors that we like, we would reinforce to increase those behaviors with a reward. And then we want to include or introduce punishments to decrease behavior that we don't want out of someone. So overall, the purpose of this intervention is to help individuals become aware of the thoughts and be aware of appropriate reactions and behaviors, and especially in social settings. So cognitive behavioral intervention characteristics, there's 5 that the book lists out. Cognitive therapy and behavioral therapy it's a combined approach, and that's essentially very obvious in the title of the intervention. Cognition is legitimate. What this means is the individual's thoughts are reasonable and genuine to them, emphasizing to them. What that means is if an individual feels like the individual feels like their thought is valid, regardless if us as the therapist think that it's an illogical thought. So it doesn't matter what we think, it all is based on what the individual thinks. Cognition is similar to behavior in the way that we study it. So when we're using a cognitive behavioral intervention, the methods we use to study behavior should also be used to study the cognition aspect. Cognition mediates behavior. What that means is behavior is a result of cognition. So if the intervention says if we alter thoughts, it will change behavior. And cognition is related to behavior. Changing one will change the other. Again, it's a combined approach, so that's why there's the 2 different aspects. But all in all, we combine them and they affect each other. So the book talks about 3 different examples of cognitive behavioral interventions in terms of anger management. So there's the anger control program, the anger coping program, and then the zipper strategy. So the anger control program really talks about how we help individuals become aware of their anger and what to do with it. So there are different types of reactions to anger, and these are examples that the book lists out. So someone might respond aggressively, someone might ignore the threat or passively accept the threat. They could withdraw to avoid it completely. And then what we hope for is for the person to cope with the situation assertively. So the point of the anger control program is to teach individuals how to do that. So sessions in an anger control program are going to include different aspects, including discussions, which is essentially like a group setting where the facilitator might ask participants like, what makes you feel angry? Or what do you notice when you're angry? Like, what does your body tell you when you're angry? It's basically like a group discussion. Modeling is exactly what it sounds like. It's showing participants appropriate behavior and behavior we want. And then behavioral rehearsal is role play. So we might break our group up into partners and give them a scenario and then have them act out how they would react or what the ideal reaction would be. So each session is going to have a goal, and the book talks about an anger control program with 12 sessions. And based on the case studies that are also in the book, your session amount is going to depend on your group and your goals, obviously. But examples of what goals would look like is obviously your first session is going to be really just introducing group rules and expectations. The third session might talk about problem identification. The 7th session might talk about, increasing awareness of your body's responses, those bodily reactions. That's a component of anger. And then like your 10th through 12th session is probably going to be practicing appropriate anger management, essentially. So all of the information and learning that participants have done in the previous sessions will help them kind of do like the role play scenario that we wouldn't want to introduce eventually. Anger coping program this is more about individuals thinking about the situation. So when I was reading anger control program versus anger coping program, they sound very similar. But what I'm kind of gathering is anger coping is more about um, awareness, while anger control is more about the reaction or the behavior um, associated with anger. But both kind of do both. So like they kind of overlap in a lot of ways. Um, the two programs that were mentioned in the book talked about a group of aggressive fourth and fifth graders, and then there was also a group with individuals with TBI, and each had different goals. With the kids, it was more of like educating them on strategies, and then like strategies to deal with anger, while the program with the individuals with TBI focus more on being aware of the feeling, being aware of physical responses, and then modeling and role playing how to cope and essentially act on those feelings appropriately. And like I said earlier, the amount of sessions varied. Again, it really seems like it's based on your audience, and that determines how many weeks you need to. And obviously, the amount of sessions per week is going to vary based on whatever group you're working with too. And then the zipper strategy was the last type of intervention discussed. Basically, this is just an easy way for kids to kind of work through anger. And this strategy is mostly used with kids. I don't think it would be effective for adults, just based on how it's used. So basically, it's Z, zip your mouth. I, identify the problem. P, pause. The other P is put yourself in charge, being assertive. And then E is explore choices. R is reset. So the way the book defines it or explains how to use a strategy is you would put each letter on kind of like a cue card. And as you're working with kids on different scenarios, you would kind of remind them of the steps. And essentially it's like thinking about the feeling, being aware of the feeling, and then learning how to respond effectively and appropriately. So there were quite a few case studies in the book. I kind of just picked ones that were interesting to me, and then I tried to kind of pick a variety of individuals that the case study studied. So the first one that I'm going to talk about is one with elementary school children. So Cole and colleagues, this is on page 217 of our textbook. There were 70 participants in this study, ages 7 to 11 years old, and they were all identified as having anger-related problems. The goal for this study was to help the participants develop anger coping strategies. So the way that the study worked is there were 70 participants, and they were broken down into groups. There were about 4 to 7 participants in each group. And then from there, groups were randomly put in cohorts. So cohort 1 and cohort 2 received an intervention period and a non-intervention period, but just at different times. So cohort 1 got their intervention period first, which means they received anger management intervention, and they were studied. And then they had a period of time where they were studied where there was no intervention. And then cohort 2 was the opposite. So cohort 2 were studied when no intervention was introduced, and then they were studied when the intervention period was introduced. And so the treatment or intervention in both cohorts was the same. It was basically teachers teaching them lessons on anger and how they can think and react differently to anger. And so the outcome for that is both groups improve their understanding of anger. So essentially, what that means to me is it doesn't necessarily matter when you introduce the intervention. It just shows that the intervention was effective in increasing awareness of anger in this age. And like I said, this more information on this is on page 217. The second case study was male adolescents. There were 21 males ages 13 to 18, and they were all institutionalized and diagnosed with a mental health condition. The goal for this study was to see if cognitive behavioral intervention did reduce anger and aggressive behavior. So this set of 21 was cut in half. So there were two groups. One was a treatment group, one was a waiting list group. As you could probably gather, the treatment group is the group that received the intervention, while the waiting list group did not receive an intervention. So they did not receive any anger management intervention. Both groups had a pretest and post-test. And the tests just measured impulsivity and self-control. And so the outcome was the treatment group showed a decrease in impulsivity and improved ratings of self-control, meaning they used their awareness and thoughts to help how they acted with anger. And so additionally, it was found that the treatment group utilized anger control techniques in situations that were simulated. So role play was introduced in this case study, and they utilized the anger control techniques effectively. So this is on page 221 if you want more information on that. But basically, this study showed that cognitive behavioral intervention did indeed reduce anger and aggressive behavior. And then this last case study was interesting to me because it was less sciencey than the others. It wasn't really a scientific study. It was more of like a self-reported study. So it was based on the participants' feelings. So there were 62 participants, adult males ages 19 to 49, and they were from 6 prisons in the UK. They were incarcerated males. The goal was to help individuals identify and utilize strategies for dealing with volatile situations. And the study was a pre and post test, and it was self-reported anger and aggression. And then drama therapy was utilized to role play. Essentially, these participants put on a play and acted out processes of anger, aggression, and violence. And so comparing the post-test to the pre-test, participants did feel that they improved their controlling of their anger. And so I picked this one because I thought it was really interesting how drama therapy was utilized in conjunction with the cognitive behavioral intervention. So that just kind of shows that, like, as a recreational therapist, we can utilize multiple interventions to kind of help individuals reach their treatment goals. And so more information on this one is on page 221. And so just to kind of wrap things up, the case studies, there were a ton, so I recommend reading them. But basically, the case studies showed that cognitive behavioral intervention or cognitive behavioral therapy is effective in anger management as far as anger knowledge, like helping people's awareness of anger, and also helping people develop strategies on how to appropriately cope with anger and act assertively, which is what we want them to do. So just some things to think about when I was reading this section. I was thinking about, like, how as a recreational therapist do I take this in and use it for my future career? one thing the book talks about is there is such a thing as an anger management specialist, and there's a certification for that. So as recreational therapists, we need to consult those people that are certified, just because they are going to be the most up to date on effective methods, and because they're certified in that intervention specifically, like they're considered an expert. So that's something to keep in mind. As with any other intervention, we are going to build sessions and programs and treatment plans around the individual. So that's kind of something that I gathered when reading the different case studies and the different types of interventions is it could be a 12-day program, it could be 18 weeks. It really just depends on the individual, what their goals are, and the frequency that we'll be able to see them, as well as like the quality of the sessions. We don't want to do like 5 sessions in a week if that's not going to be beneficial to the individual. So just, you know, just like every other intervention with recreational therapy, we kind of have to decide based on our assessment of the individual what treatment plan and intervention plan is going to work best for them. And then last, just what I said in the previous slide, multiple interventions can be used to help an individual reach a treatment goal. So the example there was using drama therapy and cognitive behavioral interventions in order to reach the end goal, which was to be able to have people cope and react to volatile situations appropriately. So thank you guys so much for watching.